Okay.
Okay. Hi, my name is Jinny Tavee. I'm one of the Neuromuscular Specialists at the Cleveland Clinic. I deal with neuromuscular diseases. The most common type of disorder that I see is neuropathy. Neuropathy, the most general term, refers to nerve damage in the feet. Most commonly, it can cause numbness, tingling, and sometimes quite severe burning pain in the feet. It usually keeps patients up at night. It's so severe at times that they will say they want to rip the bed sheets off their feet because it's so exquisite and tender. There are several causes for neuropathy. The number one cause in the U.S. is probably diabetes. Possibly number two is alcohol abuse. Number three, we guess maybe family history. 4, 5, and 6 are a toss-up. Things like autoimmune diseases, vitamin deficiencies, abnormal proteins in the blood, celiac disease in which you are not able to tolerate gluten because of an allergy. So it's very important for patients who have numbness and tingling in their feet to seek help. You can start with your primary care physician, and they can do some routine lab work, and if needed, they can send you to a neurologist and possibly a neuromuscular specialist to get further evaluation. One of the tests that we do to look for neuropathy is called an EMG, which is an electromyogram. This is not a fun test. We stick needles in you and we shock you. We don't get many Christmas cards, but it's a very helpful test to show what's damaged, how bad, and can sometimes point us towards the right direction of where to look in terms of why you have the disease. That is the million-dollar question. Why do you have neuropathy? Because if you can figure out the reason or the cause, you might be able to offer target-directed therapy to the patient. Meaning, if this is from a vitamin B12 deficiency and I give you B12, you will feel better. But if this is something like diabetes, there may not be a pill that makes everything normal again, but you have a disease, you have a diagnosis that you can treat, and sometimes it does get better. I literally just saw a patient less than an hour ago who had severe diabetes. He was only 24, and being so young when he first got diabetes, he didn't really want to deal with it. He denied it, and so he started to develop complications from the diabetes, which includes the nerve damage in the feet. So finally, when he came to me a couple of years ago, and I said, listen, this is from the diabetes, you got to take better control of your sugar, better care of your sugars. He did that. We put him on some pain medications, and he's actually better. He's not normal, but he's better, and he functions, and he takes care of his little girl. So it's good. Now, if we can't find a cause for the diabetes, if we can't find a cause for the neuropathy, then what you're going to be left with are Band-Aids. Band-Aids are like pain medications. One of the most common ones we use is something called gabapentin. It was initially used as a seizure medication, but it actually works for the nerve type pain that many of our patients have. And it's relatively safe as well. It can make you a little tired and a little goofy, but overall it's a well-tolerated medication. There are many other seizure medications, antidepressants, and specific pain medications that can be helpful as well. There are some over-the-counter medications that my patients have told me about that have been in the literature, such as acetyl L-carnitine. This is a vitamin that we already make in our bodies. Alpha-lipoic acid is another one. Glutamine, they're offering to patients at cancer centers who are undergoing chemotherapy. Chemotherapy is very toxic to nerves, and after the cancer therapy, the patients get better from the cancer, then they get this awful burning, numbness, and tingling in their hands and feet, and so it's hard to find a medication that's okay for them to take with their chemo. And things like glutamine and acetyl L-carnitine are safe and have been found to be effective too. Very simple things like Vicks Vapor Rub, even horse liniment cream, when you apply it to the feet, can be helpful. It's cheap, it's over the counter, and there's very little side effects, if any. There's also something called capsaicin cream. It's made from chili peppers that have been ground up. it burns like the dickens, but then it kind of dies away. So does the feeling in your feet, but at least the pain goes away too. Now, in addition to those measures, trying to find the underlying cause, treating it with target-directed therapy, pain medications, I also talk about 3 other things. Complementary and alternative medicine is an important part of, I think, treating the patient holistically. So I always spend the last 5-10 minutes talking about things that patients can do to improve their life and lifestyle, and thereby improving their quality of life. So out of the 3 things, the first thing I always talk about is nutrition. Food, looking at what you eat, is the first and easiest thing that everybody can do. The Chinese have been doing it for years. Food as medicine is nothing new. So what I always recommend is try to eat 3 square meals a day, or small meals throughout the day. If you're going to stack on fruits and vegetables. And my diet is very simple. Fruits, vegetables, fish, chicken, nuts. Just make sure you're getting your protein, fruits and vegetables, and you should be good. Some people can incorporate a small amount of healthy grains throughout their day, and that's fine, although a lot of my patients have allergies to gluten or some kind of sensitivity to gluten, so if you want to cut that out or limit it, that's okay too. It also helps you lose weight. I'm not very big on taking a lot of vitamin supplements. I think it's always better to get vitamin from real food. Plus, you don't always know what's in those supplements as well. So nutrition is very, very important. The second thing I always talk about is exercise. For many of my patients, exercise is their saving grace. It gets you out of your head. You're able to do something good for your body, good for your mind. And there are 4 rules of exercise. Number 1, pick something you like or you can tolerate. If you don't like it, then you're not going to do it anymore. I mean, everybody knows today is January 27th, 2015, right? So when are the gyms packed the most? January. But as the year goes on, people drop out. So you have to find something that you like. If you like Zumba, if you like jazzercise, if you enjoy running, walking, swimming, it doesn't matter. Just do it. Even if you just want to do leg lifts while you're watching Dancing with the Stars, fine, just do leg lifts. I have some patients who are very ill and they can't do very much, but walking to their mailbox, a couple of times a day, it's good enough for them, or walking around their home. Just do something. Aqua therapy is great for my patients with neuropathy who don't mind being in the water. You get to do a lot of movement, you get to do it in a class, so there's a lot of good energy there too, and you feel great afterwards. So the second rule would be, try to do something every day. Like I said, even if it's something just walking around the house a couple times, that's enough. Just do something. Number 3 would be no pain, no gain does not apply for my neurological patients. If you are tired, you have to stop, okay? Because you can't push yourself that much. You will pay for it later. And finally, there's the 2-hour rule. Patients always ask me, well, how long can I exercise? How much is too much? So the best way to gauge is the 2-hour rule. If after you've finished an exercise, whatever it is, running, swimming, whatever it is, 2 hours later you feel worse or you feel tired, that was too much. You need to go back, adjust it, reduce it, do less weights, whatever it is, until you are okay the next time you do it, and then 2 hours later you're fine, okay? So that's the 2-hour rule. So that's exercise. And then the last thing would be mind-body therapies. Mind-body therapies include things like yoga, tai chi, qigong, meditation, all of these things, kind of like exercise, they get you out of your head. Because when patients have neuropathy, for a lot of them it's painful, and chronic pain changes you. You become very focused on your pain. You can become depressed very easily, and it's normal, it's natural, because pain is pain, and it can be all-consuming. but meditation gets you out of your head. You're not doing this all day. And again, there's a shared energy when you do it in class. So people love yoga partly because you're in a class, and then Tai Chi, you can do it in a class. Even meditation you can do in a class. It's very relaxing, and if you do it right, it can be very calming, and it can really change your life. They have done many studies, very small studies, but many studies looking at what meditation can do to the brain, to the blood pressure. You can even live longer. There have been reviews in which patients who had been participating in a clinical trial many years ago were followed up 20 years later, and they found that they had a reduced risk of heart disease, cancer, and overall death. So meditation is very, very helpful. And the best part, it's free, and you can do it at home, and there are no side effects. So these are all things that I talk about with my patients.
ALS has been in the news a lot lately.
Mm-hmm.
Can you tell us what's new with ALS?
Sure. So ALS is another neuromuscular disorder. It's also known as amyotrophic lateral sclerosis or Lou Gehrig's disease. It's a very serious progressive neurological disorder. It affects the brain and the spinal cord, but it manifests itself as progressive weakness. This affects all of the muscles in your body, and eventually the ones that help you breathe. It's scary. It's usually in patients who are men over the age of 55, and the lifespan after that. Now everybody's different. There are some patients who have lived years and years, 20 years. One of my partners has a woman who's had it for over 20 years. And then sometimes it goes very quickly. I had one patient who died within 2 weeks of seeing me. He had been misdiagnosed at an outside facility, and by the time he saw me, he was already severely gone. But it can go very fast or it can go very slow. So everybody's different, and there have been a lot of clinical trials looking at all kinds of medications, antibiotics, vitamins, all just antioxidants, all kinds of things, and they've all been disappointing. However, the new thing in ALS is they found a gene. It's the C9 open reading frame 72 gene mutation that's been associated with familial ALS. But it's also been seen in sporadic ALS, meaning patients who have had no family members affected. And what's exciting about this is gene therapy is here. It's not yet here for that form of ALS, but they've been doing some research using it with another form of genetic ALS and other neuromuscular disorders. So I think that with time and all of these labs around the world collaborating, we might see a therapy for ALS in my lifetime or in this generation, which is very exciting. And I mean, thanks to everybody who did the Ice Bucket Challenge. This has raised awareness for ALS. It has raised a lot of money for ALS research, and we'll keep our fingers crossed.
Could we talk about GBS?
Sure. So GBS, also known as Guillain-Barré syndrome. The fancy doctor word is acute inflammatory demyelinating polyneuropathy, but I think that the general population is more familiar as GBS. This is an immune-mediated disorder, meaning it's your immune system attacking your nerves, usually following some kind of viral infection. It can be a cold, it can be diarrhea, it can follow a flu shot, it can even follow surgery or some kind of event that disrupts your life, it disrupts your physical status. And it usually occurs within a few weeks after the inciting event. And what happens is the classic picture. Now, there are many different variants, but the classic picture is this ascending weakness, starts in your feet and comes up and progresses upwards. The patients will complain of numbness, tingling, difficulty walking. Back pain is very common. And some people have what we call autonomic disturbances, where your blood pressure is difficult to control, your heart rate goes in and out. The biggest concern is when you develop shortness of breath. And of course, if that happens, the doctors will be watching you very carefully, and if needed, they will put in a tube down your throat to help you breathe. Fortunately, most cases of GBS are self-limited, meaning you will get better on your own even if nobody does anything. At your worst, you will be at the 3-week mark is usually the nadir or the worst of the disease, and then you just start getting better afterwards. There are 2 treatments currently available. One is called IVIG, which is IV immune globulin, and then the other one is called plasmapheresis, which is exchanging your plasma. It's kind of like dialysis where you're hooked up to a machine and it kind of filters out your blood to get the bad antibodies out. Both of them are equally effective, and they can expedite the recovery process.
How do you know if someone's going to get better?
Oh, so there is a test called an EMG that we do. Usually we don't do it in that very, very first week because it doesn't give us that much information. It's a little too early. Maybe in the first 7 to 10 days, then maybe after 7 to 10 days we'll do it. This study, which is that study I was telling about where they shock you and stick needles in you, at that time point, we would just do the nerve conduction studies where we shock you. What we use at that time is to look at the response we get from your limbs, specifically the motor component, meaning I would shock you and you should have a specific response in your hand. It'll give me a number, and if that number is markedly low or 0, that gives me an indication of how you will do over time. It's the best, most objective indicator we have right now. It's called the CMAP, or Compound Muscle Action Potential, in the most classic variant of GBS. So many patients, I tell them, after a year, what you got is what you keep. Although some patients continue to improve 2 years afterwards. But then after that, it really is a plateau. And the number one complaint that my patients have is fatigue. That's just what they have. And I wish I could fix that, but it is what it is. That's just, and so you just deal with it. Some patients do well with Ritalin. Some patients do extra cup of coffee every day. Some patients do other medications that have been used in patients with sleep disorders, and modafinil is one. But otherwise, it's just resting, making sure you're hydrated, and just use common sense in all the activities that you do.
Is Parkinson's a neuromuscular disease?
No, I'm sorry.
Okay. Where's the classification there then?
That's central. So a neuromuscular specialist sees patients who have diseases of the muscle and nerve, and then that's called the peripheral nervous system. The other nervous system is called the central nervous system, and that's disorders of the brain and the spinal cord. ALS, I know it's more brain and spinal cord, but it fits in neuromuscular. But things like Parkinson's disease, multiple sclerosis, epilepsy, those are all brain and spinal cord diseases, and they have their own specialties.
Why do seizure medications work on neuropathy?
It doesn't work on specifically for the neuropathy. It just works for pain. It's pain control.
Oh, okay.
So it just calms down the brain in response to certain stimuli, including sensory and pain stimuli. That's why.
Can we talk about? I know you mentioned gene therapy.
Mm-hmm.
Can we talk about any other hope on the horizon for neuromuscular disorders?
Sure. So a number of muscular dystrophies, like Duchenne's muscular dystrophy, if anybody remembers the Jerry Lewis telethons when they were little, and he would try to raise money for these young boys who are dying. They're normal at the beginning, and then when they're 4 or 5 years old, they start to have difficulty walking, and then it just gets worse, and then they're in a wheelchair, and unfortunately by their teens and late teens and 20s, they die. But fortunately, like I said, gene therapy is here. They're doing it at least in animal studies. I don't know how far they've gotten in humans yet, but it's here. They're doing it. They have done clinical trials with humans, but I don't know how far they've come in terms of commercially offering this to the regular population.
How about stem cell research?
Stem cell research, they are doing it in ALS right now. University of Michigan and Emory are 2 of some of the places that have been doing it in the country. And the motor neuron cells are growing. I don't think it's ready yet for prime time, though. But it's promising.
How much sustainable nerve tissue would they have to grow for this to become a viable option?
That's a good question. I mean, an inch or 2 inches is not going to be enough. So we'll just have to see. We'll have to see. I don't have a specific answer for that.
Okay, I think the last question I'm gonna ask is for the people watching this at home.
Mm-hmm.
If they are experiencing certain symptoms, like, can you just tell us, when do you call your doctor? When do you go to the emergency room? When do you call, an ambulance if you have to? How do you know when to be alarmed?
If you have a sudden change in your status that affects breathing, for sure. If you think your heart is involved, for sure, get yourself to the emergency room. If you have sudden stroke-like symptoms where one side of your body is weak or completely numb, you can't talk very well, you have vision changes, yes, I would get to the emergency room immediately.
Is there any way to prevent neuromuscular disorders from developing? Or?
Just keep as healthy as you can. I mean, if it's meant to be, it's going to happen, right?
Yeah.
But there are choices that we make in our lives that can affect our nerves and our brain. So just do the best you can. That's what we all do, right? Okay.
Thank you so much.
Thank you for having me.